I think the challenges have to do with training, understanding the appropriate use, and of course, when to use this in a setting where cost is a concern. So I think we start off with how we can help our patients, and that starts with patient indication. So the selection of patients, the appropriateness of indication will be the key things I think we learned from today's session at SingLIVE. The other thing which I think is important is that as much as we select the right patients, we also need to learn how to use the devices or the technologies correctly. And with the live cases, we get to see our expert operators, the masters in their various fields, demonstrate the appropriate technique and how very subtle technique changes can effect a very good outcome for patients.
I think one of the biggest advancements, or what actually made the technology move on, is intravascular imaging, because from the intravascular point of view, we get a better understanding of what calcium looks like, what the composition of the plaques are, and it is actually based on the understanding of what the vessel looks like, or the disease, the nature of the disease, that we get to choose the most suitable device for each patient in terms of calcium modification, in terms of even medication. So for example, if you have a patient with a very big lipid burden, you might think, I'm going to lower the patient's LDL even lower with what drugs we have right now. So I do think the understanding of these plaques are based on what we found from intravascular imaging. This is actually changed a lot of things over the recent years.
One area in particular that I think that we are all keenly interested in is the area of calcified lesions. And this is increasingly relevant in our practice, where we're seeing more and more elderly patients, those with complex disease, where calcification is almost certainly to be present. And there are various approaches to it. And also the growth of intravascular imaging has also now guided us in how we might approach some of these lesions. As it is, however, there remains to be seen the definitive management of some of these very complicated calcified lesions, specifically the calcified nodule. And I certainly look forward to learning and hearing from our colleagues how to best approach these complex lesions.
I think mainly if you look at newer technologies, we have seen a rise, in my field of interventional cardiology, you have seen the rise in calcium modification technologies, the most recent one being intravascular lithotripsy. And I think newer technologies that actually combine and look at unmet needs within this space is what I'm looking forward to discovering. And in the areas of CTO, chronic total occlusion, I think we need to come up with more effective ways to ensure success. I think newer devices are definitely needed in this field, probably not just to ensure success, but to make sure that these procedures are done safely.